Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, man, we're pretty excited to have you here. You know why? Because we're having some pretty phenomenal conversations with real leaders that are painstakingly shaping the future of healthcare. And we happen to be really passionate around healthcare innovation adoption, leadership, access, and all those things that make things move forward. So if it's your first time tuning in, let me just sort of take a quick step back and let you know a little bit more about what we're trying to do here. So we're a healthcare innovation company, and we're focused on bringing stories of innovation to life within our space. And the objective is really to highlight people that are really innovating within this space and share their stories with our community and with the world. We've got just an incredibly action-packed year with some amazing interviews. And if you haven't had the opportunity to check out any of the historical interviews, make sure that you hit the subscribe button now, and all the new interviews will come directly to you. So in this rapidly changing field that we've got going on right now, it's essential to have leaders that really see the future, embrace new ideas, and really know how to put them into practice. And our next guest is Blas Brown Jr. He's one of these leaders. Blas is the business director of perioperative services at MedStar Washington Hospital Center. He uses his skills in financial management, budgeting, risk assessment, and data analysis to improve healthcare services. You know, with his help, the hospital's really made some incredible advancements in patient care, and his role really sort of underscores the vital intersection between data, healthcare services, and that nexus that Blas has really been navigating with the finesse and unwavering commitment to excellence. And not only is he just sort of deeply skilled and knowledgeable about innovative strategies, but he's really kind of garnered the respect amongst his peers and understanding who his customers are and how he can serve them better and ultimately get the best patient outcomes. And his journey provides valuable insights into healthcare innovation and data use, in OR operational excellence and the power of collaboration. He's also an active member within the Alpha Phi Alpha fraternity and a dedicated executive board member for the Ronald McDonald House Charities. He really epitomizes the spirit of giving back, showcasing his passion for making a difference beyond just the four walls of a hospital and impacting the lives of those through compassion and leadership. So Blas, it's amazing to have you on the show. Welcome.
Thank you for that introduction, Michael. Thank you very much. I'm very humbled to hear those words come from you. And just for a point of clarification, I am a former board member for the Ronald McDonald House.
Okay.
I used to be a leader for them, and I had a lot of great opportunities and moments with that charity and supporting their great cause for families. But anyhow, I'm grateful to be here. Grateful to
Yeah.
sit with
Yeah.
you
So
about healthcare.
I want to really sort of dig into sort of your focus and your role. And maybe before we do that, let's maybe spend just a couple of minutes to hear a little bit about some of the tours of duty that you've had along the way in terms of the seat that you're sitting in now. Would you mind maybe just sharing with the audience just a little bit about that journey?
Sure, definitely, Michael. So in terms of my current role now, I'm the business director for perioperative services here at MedStar Washington Hospital Center, which is a level one trauma center here in the DC, Maryland, Virginia region, one of the larger hospitals here. Before I took this role, I was working at University of Florida Health, another level one trauma center, large bed hospital in the Gainesville, Florida area. And during my time there, I had a couple of different roles in healthcare. Started out as a coordinator of business for the operating room while I was doing my MBA, and I moved up to an assistant business manager. Then I had the latest role there, which was a manager of statistical data, which I actually had an opportunity to work closely with our operations partners in the hospital and our executive leadership in constructing some of the volume budget for the hospital for the last 4 years or so when I was there at the time. After having that opportunity to work with the leadership of the hospital and operations side, I decided to come back to the OR. Obviously, the OR was my first introduction to hospital healthcare, and I still have a passion and a love for it. So it led me to coming back into this role that I'm currently at here as a director of business for the OR. And I've had the opportunity to work with extremely talented colleagues here at MedStar and helping me develop as a leader, but also helping us reach our goal as an organization as well.
Amazing. So when you talk about collaborating your customers, can you maybe just share a little bit about who are the customers that you're currently serving outside of the patients?
So for us here in the OR, primarily, when you say the word customers, the first thing for us that comes to mind is our surgeons. Our surgeons here that operate daily, very talented individuals, and we actually have a lot of different specialties here that we cover. And when we say patients, or not patients, excuse me, when we say customers, we really look at how us as administrators and leaders can provide the tools, resources necessary for not only our surgeons but our nurses, so that they can provide the ultimate, best care to our patients, which are the reason for us being here.
Absolutely. And when you think about innovation as you've evolved in your career, has how has that definition has that evolved as well? How do you define innovation in the seat that you're sitting in today?
So that's a very good question. And when we think about innovation, you're thinking about how can you be creative in in accomplishing or reaching those strategic goals that your organization puts in place before you. For us, when it comes to innovation, we think of how can we be more efficient, right? How can we use some of the tools that are out there to be more efficient without really reinventing the wheel, so to speak? So really leaning on some of what was done before us, leaning on what other reviewing what other areas have had success with, right? I think that's where we're
Mhm.
able to then lean on innovative thoughts and come in with different practices that can help us be more efficient and help us to reach the goals that we're trying to maintain for our organization.
When you say efficiency, like, let's dig in there a little bit. I mean, what areas do you feel like, are inefficient, within the OR? Like, what are like the top three that you really are like, man, we need to improve here? What are those?
Well, I mean, for us, our KPIs are pretty standard in this industry for when it comes to when it comes to perioperative services. So, for example, first case on time starts, making sure that we start the day off on time, because there's a trickle down effect that could be adverse if we don't, right? You can
Right.
imagine where those delays pile up and, we may not be able to get all the cases that we initially slated for. So number one, I would say, is, first case on time starts. Then in between that, how are we turning over rooms? Are we efficient in making sure that we're prepping, cleaning rooms quickly and efficiently so that we can get to that next case on time and maintain a level of efficiency and throughput for the day? So, turnover time would definitely be the next one in line there. And then making sure, how are we utilizing our blocks, right? How are we making sure that from a block scheduling perspective and utilization, that our providers and our teams are efficiently using the time that's allotted to them or their service lines? So taking a stab at those top three metrics would be the way to really focus on how can we be more efficient, and then looking at what tools are available out there to help us innovate and be a little bit more efficient in that respect.
Yeah, when I think about the OR, I think about it. I mean, this is like a logistics machine. Things need to be, in places in certain times on time, and small things can mean big ramifications down the line. How do you balance process, and then knowing when to actually incorporate technology to do that? Like, at what point do you feel like, man, like we now have to move to tech? Like, what has to happen there?
I think with any company organization, it takes a couple of instances of having failures in your process, right? And understanding what those failures are and having the right people at the table, meaning the right leadership, to support you in in terms of how do you solve those issues? How do you solve those problems, right? For example, if you're having issues with first case on time starts, and we're noticing that, every day we're trying to accomplish 80 cases per day, but we're only eclipsing 75, you'd have to then take a look at, well, what can we do differently throughout the day? Is it our turnover time? Is it because, we're not starting the second case on time? What is the issue? And then by having the right people in place to help you drive those processes that you're going to build, then you're able to then turn around and say, yeah, this is actually working for us.
Do you have a real life example that you can maybe sort of share just to make that a little bit more concrete for the audience?
Sure. I mean, one of the things I can tell you is that when we started our first case on time starts mission, and when I say mission, I'm talking about when we really started to focus on this particular KPI. And when I say KPI, I mean key
Hmm.
performance indicator, just for clarification. So when we started to really focus on this, we, during our rounds in the morning at 7:30, which is when our first cases would begin, we have our CEO, our CMO, and sometimes our COO and our Chief Nursing Officer as well, CNO, that would accompany us on these rounds. And when they took note of some of the issues that we were having, it didn't take long for them to partner with us to help us send a message to our providers that this is something that we want to focus on.
By
I'll
the
take
way,
it.
is it typical that those key leaders will round with you in the morning?
Yes, from my understanding, there are some institutions that do that, and it's
Okay.
common practice to have them do rounds with the leaders, especially in the mornings, because it's the beginning of the day, and it's an opportunity to see how we're going to start and have an idea of how we might end the day. We also do periodic huddles throughout the day at 9 a.m. and we also around to share, you know, having them present was very helpful in pushing the message to the providers, such as the surgeons, and getting their buy-in in terms of the importance and why we really need to focus on starting our cases on time. In addition to just our local leadership at our hospital, we
What
also
but
had
by the way,
these.
hold on a second. Hold on a second. What happened that caused the first case to not go off on time? Because you would think that maybe the night before things were organized. Like what were some of the causes of that made that not happen?
Well, that's a good question, Michael. It's multifactorial. Every day,
Mm.
sometimes it's very different. For example, one day you can have callouts in SPD, and that can impact the ability to prepare for the next day. So if you don't have enough manpower to prepare, you're going to be delayed in having those essential equipment necessary for those case cards. That could happen. You can have nursing callouts where rooms would not be prepared because
Tell me a little bit more. Are there any other examples that come to mind in terms of areas of efficiency that can be improved?
So yeah, so another example in terms of efficiencies that we've had that we were able to target and improve. Turnover time was definitely another one that was a painful area for our EVS partners, but not to point all the blame on any particular area. It really is a collaborative effort to turn a room
Yeah.
over. It starts
Yeah.
from the provider to the nurse to the techs in the room and the EVS team. So it's really a lot of areas that impact that one metric, but it's how we were collaborating that was really, I feel, the issue. And maybe also the lack of communicating at the right time, right, in terms of timing.
Mm.
So a lot of that rectified through different PI initiatives that we had through the system leadership and our local process improvement leadership.
Interesting. And where do you see in terms of the next year or so? I mean, how far out do you look in terms of where you can innovate, and how do you rank areas in which you can innovate? Is there a process that you and the team go through when you're collaborating?
So in terms of where we have opportunities to innovate, is that what you're asking?
Yeah,
Like, how do we come up with the,
yeah,
okay. So yeah, that's a good question. So I think for us, mainly we look at, we definitely focus on our metrics and we see where we are with those. In terms of understanding the needs, there's a there's a really big focus from a corporate level on how we do things, right? So there's a lot of direction we receive from the corporate office that's not necessarily a plan or any kind of it's not a plan that we come up with here at the local level at our site. So keep in mind, as I may have shared with you in the past, we're 1 out of 10 hospitals in our healthcare system. So,
right.
and we are the largest. So at times we do kind of lead that push in terms of the transition to anything that's innovative or any new ideas, but not all the time. It depends on the specialty, obviously.
Hmm.
But for us, a lot of the decision making and the process and how we come up with that is really handed down to us from our system leadership. And I can't tell you exactly what their recipe is for that, but what I do
Right.
know is that, there's a lot of time spent looking at what is going well in the industry, what is not going well, what are the areas of concerns for us from a regional standpoint, and also from, from a regulatory standpoint in making sure that we are meeting any type of criterias or any kind of requirements that's handed down to us from our governing bodies.
Mm. And you mentioned 10 hospitals. I mean, what's the collaboration like with other, with some of your peers, other perioperative leaders? Does that happen on a regular basis, or is that sort of ad hoc? Talk about that in terms of the teamwork that happens inside of different hospitals that you can kind of collaborate with.
Sure. One of the things that was instituted here at our hospital through our system leadership is called the perioperative service line. And what it is an actual service line that um, where we all work to helping one another when it comes to our capital purchases, contract negotiations. There's a lot of collaboration, honestly, between all of the hospitals. We do have a director that's over us from the corporate level, very
Right.
similar in my role, but more so on the corporate side, where their role is to keep us all, you know, keep us all working together, keep us in synergy, help us to focus on those things that are important, and also to help us help one another so that no one is really reinventing the wheel, and to really leverage all of our knowledge so that we can help bring each other up, so to speak.
Yeah. Yeah. And I know that when you're inside of these multidisciplinary teams, it's
Alrighty.
so kind of picking back up where we left off. When you have multidisciplinary teams, innovation is really hard. It's hard to get people to align. And what have you found to be sort of the recipe to get some of these busy folks together around these important initiatives? What's worked best for you and the team?
That's a very good question, Mike. And I think for us, the main thing is having leadership from the corporate level
Mm,
be the sponsor. So having one corporate leader lead the charge for us and sponsor this group and let it be known across the system to the other leaders that this is, obviously with the right reasons outlined in terms of why we're doing this, the business rationale behind it and how it can really help elevate the not just one particular hospital, but the entire system. When you think
yeah,
about it, the OR is the economic engine of any hospital. And when you can fortify that group by synergizing and putting together all the different business ops leaders, you're able to really leverage not just the power of the individual hospitals, hospitals, but of the system. And
Mm,
by that, you're really opening yourself to opportunities a lot of savings from a financial standpoint. Also leveraging your contracts and making sure that you can have the best situation from a financial perspective on the different contracts that you're setting up. So, it just goes to show for us the biggest recipe piece that was there for us that really helped us, I believe, was having our system leadership sponsor this group and then have a really planned structure that's outlined. And that shows, how this group will operate. Having a very well thought out governance plan for this group is what I think is the recipe to success.
mm. So having that laid out in advance, and there's been a lot of noise just around staffing. You mentioned around nurses calling out, and I haven't spoken to one administrator that hasn't dealt with that issue. Wh- What do you find is the sort of the key to success when it comes to working with your nursing ancillary team? What have you found to be sort of a useful tool aside from having great leadership, right? I mean, because you can't innovate unless you have good leaders. What have you seen to be able to kind of get that level of connectivity and buy-in from that level of the team?
So that's definitely an industry issue, right? Staffing, when you hear it. We've spent so much money, honestly, in our contract labor. It's just mind-boggling, and sometimes you wonder if it's going to change. What I can say for us has worked is, there isn't anything that I would say is the consistent one answer or one solution to this problem. But what has worked is, for us recently, there was a negotiation with our union, nursing union, and there was some price rate increases, which was a huge help to maintaining our existing nursing team across the board. In addition to that, I would say that really fostering a culture of belonging and really working with our contract labor teams so that they feel that they're part of our team, right? You
Mm,
have a lot of individuals that aren't from this area, or they're just kind of passing through, so to speak. But what I've seen is that we have had an increase in those that were contract laborers that have decided to stay with us. Yes, we've had some that leave, but we've also seen a pattern of nursing associates that decided to stay and become permanent employees. And that's despite the lower rate that they may receive. But there's always that opportunity to negotiate, which I think a lot of them have taken. So, I can say that has helped us a lot. One of the things in terms of nursing and staffing is that we have a very strong bridge program. So we've been able to do a very good job internally recruiting. Another opportunity that we've had and we've really utilized is really reaching out to some of these community colleges and nursing programs and kind of starting
nice.
to create and develop a pool, and more of a pool that will help funnel them into our hospital and into our organization, not necessarily our hospital, but within
Right.
the organization is what we're more aimed at. And so, you know, honestly, it's a major issue, as I said, but we've found different things that have worked for us here. We can't say that it's a one size fit all, obviously, but we've had some success in those areas.
Mm, good answer. Yeah, I think employees don't leave organizations; they leave bad leadership. That's just the hard truth. I know that you go to a lot of different conferences and things. What have you seen from an innovation standpoint that has you excited? And what is it?
I've seen a lot of technology in this past year. I've been to several conferences, fortunately enough, and I know in the OR there's tons of technology, and there's tons of mom and pop companies, there's tons of large mainstream companies, like your Carl Stores and your Strikers. But for us, I think for me, one of the major ones I've seen that has been very helpful is lean toss. I
Mm.
think I maybe have shared this with you in the past, but we're kind of in that implementation phase right now with them, and that's a very amazing technology. And I don't work for them. This is not a plug for them, but I
Right.
just I just want to say that we've had our challenges, but I think there's more positivity down the road for us in terms of
Mm.
our utilization with this technology. Another one I would share is, and I'm not too keen on all of the details behind this one, but I know Carl Stores has some really great integration programs within the OR, that our sister hospital has been using. I know we have some of it in one of our hybrid ORs, but it's really great technology. And like I said, I'm not here to plug for any of these companies, but you asked about technology
Yeah,
and
no, I mean,
use.
sometimes when you talk about vendors, right, which a vendor will say that they can't stand that word, they want to be considered more like partners. Um, that's great that you can actually shout them out because they've done a good job. How about maybe just give a little bit of a commercial about, some of the things that you're working on? How can people reach you? How can they continue to follow your journey, your story, and MedStar?
Yeah, I mean, I'm not hard to find. You can just go on LinkedIn. But in terms of what we're currently working on, right now for us, I think, we've concluded a lot of projects in this last, I would say, calendar year. It's been challenging to keep up with. I won't, I'm not, I will admit it's been very challenging to keep up with, um, from a system perspective. And then, locally, you have your own, things that you're dealing with and working on. For us right now, we're just looking at ways to constantly improve our KPIs. And I think that's ongoing with every OR in this country.
Right.
You're always looking for ways to improve. Right now, the biggest thing we're working on is turnover time. One of our major challenges in SPD specifically is, the back ordering of parts for sets to
Mm.
complete them. That has been a major, major issue for us. And I think a lot of departments across the country can probably share the same. But I think, what we're trying to do is really work closely with our SPD leadership to kind of develop ways that we can, if it's more education that we have to give our associates in the OR, then that's what we'll do. But we're trying to work on ways to just do better in terms of managing our equipment, so that we don't have things, constantly being lost or damaged to where we're now waiting on back orders to replace those sets and put them back in circulation. So I think for us, that's one of the two things: turnover, working on SPD with the back orders. Some of these things we really don't have too much control over. Some we do,
Right.
and but yeah, I think for us, that's pretty much it. Trying to create capacity, honestly, would be a third. I would say that's honestly a challenge when you're already fitted with these OR spaces that are a little older, for some of the evolution of technology
Right.
and how cases can be done. So yeah, capacity I know is another one that's everyone's issue, but I think that's also one that we're challenged with.
Boss, I just appreciate your honesty, sharing the wins and also sharing maybe some of the things that you're focused on. And honestly, that's really the best way to innovate. The best way to innovate is understanding your problems and knowing them really, really well. And I think it was Einstein that said this is that the level of thought that has to go into solving a problem isn't the same as, initially understanding it. So for those that have been tuning in, and that maybe heard some of these challenges and you're working on something, you obviously know who to reach and how to contact them. But thank you so much for taking time out of your really incredibly busy schedule to share some of these insights with us. We appreciate it. And for those that have been, if you've been listening and you found this conversation particularly enlightening, please hit the like button, comment on it, share with us what you liked about it and where you plan on taking action. So Blas, pleasure to have you on and look forward to maybe our next conversation.
Yes, sir. Thank you, Michael. Thank you for having me.